This is Jenna Likina on eyesurgeontalks. I wanted to discuss expectations of patients and what you might come across after having a cataract operation. So you have had your surgery, you have come out of the operating theatre, and what happens next? Well, the eye will still be numb and comfortable after the operation, and this will be the case for anything between 15 minutes and another couple of hours, depending on the type of anaesthetic you've had. And for that reason, we usually put a protective cover on the eye, because if the eye is still numb from the anaesthetic, you may not feel any sort of injury or accidental scratch on the eye. And most commonly we'll use a clear plastic shield which covers the eye but lets you see through it, or sometimes a pad which covers the eye and closes the eyelid, and you can't see through that, and that's usually used for the deeper anaesthetics and stays on for a little bit longer. The nursing staff on the ward will usually go through the post-operative care with you. And what does the post-operative care involve? Well, the shield, the cover for the eye that we put on, you'll need to put that on at night time, between 1 and 2 weeks after surgery. And that is just to prevent you accidentally rolling onto the eye at night and damaging things. Otherwise, things should be fairly robust. We always advise not to rub the eye hard and not to get anything foreign into it, so no sort of soapy water running into the eye in the shower for a little while after surgery, and avoiding hot, steamy environments. But otherwise, most activities are absolutely fine. You can certainly get on with your daily living, you can go out for a walk, you can do normal household tasks. In the old days, we used to have big sort of wounds in the eye after surgery, but nowadays the surgery is so fine that we use tiny openings that pretty much self-seal straight away, and so the risk of any contamination through those is minimal, but we still like to take care. In terms of exercise, you can certainly get on with light exercise straight away. Probably heavier exercise, big gym sessions or long runs are best put off for a week or two. And the same will apply to swimming, just to avoid that pool water going into the eye for a week or two. Otherwise, you will be given some drops, and these are anti-inflammatory drops. Now, some centres have stopped using drops after surgery, which is fine. In this scenario, they will usually give you a depot, sort of an injection at the end of the operation, which lasts you in a sort of a prolonged period after surgery. But a lot of units will still use drops. And these will typically need to go in 4 times a day for a few weeks after the operation. If you're struggling to put the drops in, there are a number of techniques to help you. One of which is to tip your head back and trickle a drop into the corner of the eye and just let it sit there. And if you blink your eye, it will roll into the right place inside. Or there are special devices which you can ask nurses about, which can sometimes help administer the eye drops. Otherwise, for follow-up, this will vary quite widely. You may be seen in a few days to a week by the operating surgeon, especially if the surgery was tricky or if there was any kind of problem during the operation. If the surgery was smooth and routine, occasionally you will not receive a formal follow-up, perhaps a telephone call to check that everything is all right. And other centres will see you at maybe 2-3 weeks. It is important to see your optician about 6 weeks after surgery, and because they will be able to fine-tune your glasses and also double-check the eye to make sure everything is settling well.